right, folks. Day 3. Of course, this is going to be a progression that's pretty small if I go day by day, but I figured it made sense to do, a daily update just in case there were any milestones that popped up early on, because swelling is going down and some things heal faster than other things that might ultimately have a big impact on how well things function. So here we are, day 3. I'm back to the cane again. I've gotten to a point where I can shift my weight, and I know you can't see the whole leg, but I can shift my weight onto this leg. Not 100%, I'm not trying to be crazy and do that, but I can go 50-50, which is going to be nice because my right hip is on fire from having to carry my weight the whole time. Still obviously leaning a certain way. I do keep the brace locked when I'm walking, when I'm weight bearing. That'll eventually change, of course. Did some more aggressive exercises earlier today, a little while ago, shortly after getting up, and I recorded that video. I'll tack that on to the end here. And I've experimented a little bit with how it feels and how much movement I can get if I loosen the brace. I hadn't really done that before, just like undoing the straps. And that does, of course, help with range of motion whenever I'm doing the passive stuff, trying to flex my knees some more and all of that. And I'll be doing that more completely probably later today when I open everything up and take the wraps off. So I just get down to the surgical dressings because I'm approved to do that after a few days. So this is the 3rd day, and in a couple hours I'll be exactly 3 days post-op. So there we are. As far as my ability to walk, stepping backwards is kind of tricky, but if I'm slow, I can do it. Turning, of course, like I said on yesterday's video, I just want to make sure I pivot on my good foot, and then I'm okay. And if I use the crutches instead, I can actually move a lot faster, but I don't have a free hand. So that's sort of the trade-off. And of course, if I want to move faster, I have my counter here. Not a big deal. I can deal with that. Not ready to take on the stairs yet. I'm hoping by the end of this coming week, I will be doing that. For those who don't know, my apartment is up on the 3rd floor of my building. So I knew that was going to suck. I knew that was going to be an issue. But the plus side is I don't get messed with as often. People don't harass me here because they don't want to climb all the stairs. So there it is. Not a whole lot else to update on in terms of just the kind of standy walky thing. As my capabilities improve, I will be sharing updates on those though. When I get back to any kind of formal like gym exercise, of course I'll be updating on that. In the meantime though, it's just getting more and more used to walking, slowly putting more weight on the affected leg, getting things to look a little bit more even. I can actually stand without the cane or without any support, and I can even kind of shuffle a little bit. But I don't really want to lift my good leg off the ground completely, so it's more like I kind of shimmy it across the floor, and then I can pick up my bad leg and kind of shimmy my other leg forward. So it's a little tricky. But the good thing is the pain has gone down enough that if I accidentally bump my leg, not as bad. When I'm picking my leg up, like grabbing it to move it and prop it up somewhere or whatever, that is becoming a less arduous process because things aren't so tender and sensitive in there. There is still a lot of pain, but it's more like a dull ache. I'm not getting as much of the sharp sort of pain that I was getting before. The nerve block is completely worn off. I haven't taken any meds yet today, and I may not because I may be having a couple of drinks with a friend. So I don't want to go mixing opioids and alcohol. Probably not a good idea. Actually, I know it's not a good idea. So don't do it, kids. Anyway, that's where we are. Swelling in my foot has pretty much gone down. Since I'm moving things more, blood isn't pooling quite as much. My calf is still a little sore, probably from some blood pooling, but it's not as bad as it was. And with that, I think I'll end things here, hobble on over. And like I said, I'll splice in that other video of the exercises I was doing this morning. It's sort of a repeat of the flexion things, unlocking the brace. But I'm going a little bit more aggressively and starting to get more range now. So stay tuned for that. All right, 3rd morning post-op. So in a couple of hours, I'll be 3 days properly post-op. after my ACL reconstruction. I've undone the brackets again. I'm spending more time like that now when I'm lying down, relaxing. I'm actually undoing these locks on the brace so that, I can play with the motion a little bit, and even just turning my leg back and forth so I can get into a slightly more comfortable position as I lie down. It helps with that. So I'm glad I can now tolerate a little bit of motion without, it hurting or feeling too terribly unstable. I'm still locking this back when I walk, but I'm spending more time with the brace unlocked when I'm not walking. Later on today, I'm going to be probably unwrapping this to take a look at the dressing and clean things up. But I back up a bit here. Here's what we're doing. Just trying to get some motion back. See if I can show the mechanism here. So you can see the gap right in there. If it's totally straight, this little piece right here basically will be all the way in and be obscured. So you can see that gap open up as I bend my knee. Okay. And yes, my room is very messy right now. But I'm getting more motion than I was yesterday. Getting used to some motion. And some of this is restricted just because the wraps are so tight. I'm able to tolerate some pressure on here now. There's a lot of soreness here and even down into my calf area. Some of that I think is from blood pooling. But here we are. I have this, actually it's just a pillowcase right here that I'm going to use kind of like a towel or a strap to assist with pulling my heel back. But right now I'm trying to see how much I can do just on my own. So I'm not even going to use my other hand. Let's see what I can do here. So I try to straighten it. Quad contraction still hurts. Will for a long time, I'm sure. Now we pull it back. So I can't tell exactly how much range that is that I'm getting, but I don't know, maybe 15 degrees? 10 or 15? If I'd use my hand to assist here, so my hand's underneath, I can go a little farther. There is a burn though, because there's pressure it's putting on the front of the knee where the major incision was. So, a lot of it's just going to be tolerating the pain and the discomfort and continuing to move things. There's also a slight itch I'm getting around this site, which I imagine is normal. Areas just get irritated, But I'll be taking the brace off and doing an unwrap on that and taking all these wraps off probably today. So maybe doing a video on that. But this is where I am with my exercise this morning. Might show, do a segment where I'm just showing how I'm walking as well. So we've got that, and then again, quad contractions. And you can see that's me contracting my quad a little bit right now. It does hurt over here when I do that. I am not strong enough to lift my leg up yet without assisting with my hand. I am trying to slowly engage my quad more as I do that, so I don't have to use my arm as much. It's going to take some time. But there we are. Exercise for day 3.